Well, a team of experts from the CDC arrived in Chicago to help manage a measles outbreak. City health officials linked at least 7 cases to a migrant shelter, and now the CDC is working closely, working to closely with the city to identify people who may be at risk of getting sick. So for more on this, we are joined by Susan Bleasdale. She is the Chief Quality Officer at the University of Illinois Hospital and Health. Thank you so much for joining us. Okay, so, for a lot of people, measles is kind of a thing of the past. You don't hear about people getting measles anymore, right? So remind us of just how contagious measles are and how dangerous it is for an unvaccinated child.
True. So yes, you're right. We really have not seen much measles over the last several years. Small little pockets of outbreaks, and it's related to people not being vaccinated or not being completely vaccinated. Measles is very contagious. It is spread through the air, and it is something that those that are close to someone with measles that are vulnerable and not protected by vaccination, somewhere around 90% of the people that are exposed to it will develop measles. And the problem with it is that it's a fever, it's a rash, and it's a runny nose, it's a conjunctivitis, but there are complications related to measles. In about 1 out of every 1,000 cases of measles can develop an infection in the brain called encephalitis, and that can cause significant complications. They also can suffer from respiratory issues, and there is anywhere between 2 and 3 per every 1,000 cases of individuals that may die from measles. So this is why it's so important to get vaccinated and to help to control this particular case for us here in Chicago.
What other demographics are you looking at in terms of the spread of measles in Chicago specifically?
Well, again, this is associated with a shelter, which is a unique setting with a large number of people with potential exposure. Thankfully, many of the individuals that are at the shelter have been vaccinated, but similar to what many people have faced in the pandemic, may have missed their regular health visits and may have missed opportunity for vaccine and may not be completely vaccinated. And so this is where it's really important to get those that are exposed vaccinated. There have been teams of people partnered with the departments of public health. We have a team from UIC that's been participating and administering vaccine at this shelter and other areas across the city. And this is helping us to protect these in this population. The important thing is those that are vulnerable and that have compromised immune systems are the ones that also are at risk despite being vaccinated. And so that's really important that those individuals are protected in this outbreak.
All right, Susan Bleasdale, thank you very much. We appreciate it.